What we really need to consider in the real-world treatment of patients with tardive dyskinesia are the intersection of the biological factors, psychological factors, and social factors. At the intersection of these factors is where we may see the real detriment to the quality of life and functioning outcomes that a patient with TD could experience. These can be difficult to measure, but it helps to know what kind of questions to ask for those domains. For instance, we might ask questions about their physical health, such as whether the patient chokes on food, bites their tongue or cheek, or has difficulty speaking or breathing. These are all real-world outcomes that I've seen in my patients with TD. We also need to consider asking about psychological factors, like feelings of embarrassment or distress, reluctance to go out in public. That's all part of the assessment we should be doing in every patient with TD. And finally, socially, does the patient have difficulty engaging in work or leisure activities because of their TD? It could have affected their relationships with their family, friends, or colleagues. These are questions we need to get used to learning how to ask and consider. For James, one of the keys to his treatment is that he really can't remember to take his medication more than once a day. So I've tailored his medications to make sure he takes it once a day at night. To maintain that kind of simple regimen for him, to make sure he's able to maintain adherence, we can add valbenazine, which is a once daily medication. Per the prescribing information, we started valbenazine at 40 milligrams once a day, which again, he took at bedtime, and then after 1 week, increased to 80 milligrams. It's important to discuss with your patients, like I did with James, some of the potential adverse effects that they might experience. For instance, that could be somnolence with valbenazine. Deutetrabenazine has slightly different common adverse reactions, like nasopharyngitis and insomnia. And with both VMAT2 inhibitors, there is a risk of Parkinsonism, which is something that James experienced already in his past, so we need to be mindful of that. Now that we've initiated James on treatment with valbenazine, we need to talk about what's expected and how to monitor results.